Cancer of the head and neck is the sixth most common cancer in the U.S. 20 years ago, these cancers were seen mostly in older men who were heavy smokers, and the cure rates were low. Today, these cancers are becoming more common and affecting men and women equally, often at a much younger age. Researchers at the University of Michigan have been studying head and neck cancers and their relationship with a common sexually transmitted virus.
We're trying to understand why the epidemiology and the demographics of these cancers seems to be changing. And one of the factors that seems to be most important is the fact that many of these cancers now are related to human papillomavirus 16. 20 years ago, perhaps 1 out of 10 patients might have a throat cancer that was related to human papillomavirus. Now, 90% of the patients we're seeing are human papillomavirus positive.
There are over 100 strains of human papillomavirus, or HPV. The ones most closely related with cancers of the head and neck are also the types that cause cervical cancer in women.
These cancers tend to behave differently. They're not associated with the usual things that cause throat cancers, and the prognosis is actually much better for these cancers than the more typical head and neck cancers that we've dealt with in the past.
Researchers at the University of Michigan have been studying these HPV-related head and neck cancers to determine if the body's natural immune system is more successful in killing HPV-positive cancer cells than HPV-negative ones.
There's a group of cells responsible for killing tumor cells, and we found that those killer cells were significantly higher in the blood of patients with HPV-positive cancers than compared to those patients with HPV-negative cancers. And although this doesn't really prove why those patients do better, it's one more clue as to why the prognosis for these patients is better and their response to treatment is better.
This information may help physicians target the most appropriate treatment for their patients suffering from head and neck cancers.
In the past, we would give toxic chemotherapy to a patient, look at how the tumor would respond, and then decide whether they needed surgery or radiation. But now, with patients who have HPV-positive cancers, we can look in the microscope, determine that, and we can select a treatment that is going to be potentially less toxic for them and highly effective in terms of overall cure. The next step of the research would be to prove that those killer T lymphocytes were responsible for the better outcome. Then we might devise ways to take those poor patients who might not be HPV positive and improve their immune system through immunotherapeutic approaches and make them more sensitive and, again, more successfully treated.